hope. It's so common that people go to doctors and they're told there's nothing they can do. They go online, it's doom and gloom. And the more years I've been doing this, I've been specializing in tinnitus now for 10 years as a professional with grad school and then being a doctor. And the more and more I do this, the more and more hopeful and optimistic I am, because I see it over and over. Cases that are told there's nothing they can do actually improve their conditions. Hey everyone, welcome to episode 1 of the Ask Treble Health Show. I'm your host, Dr. Ben Thompson, tinnitus specialist. So excited to be here with you guys. Our first guest, our first presentation here, our first question comes from Riz. Hello, Riz. How can we help? What is your question?
So, I'm a musician, and also I've had a lot of problems going on personally over the last sort of year. And literally, I just woke up in April of this year with high-pitched tone in my right ear. I've done loads of research. I've done lots of other alternative therapies, TMJ, acupuncture, audiology. I've had all of that because I look after my ears anyway, because as a musician, you need to take care of them. And I've not, suffered any form of trauma. So I think my main objective, I am booked in to have an MRI. I went to see the ENT last week and they just want to check that it's nothing untoward, because obviously it's in one ear only. But they looked and they didn't think there was anything, suspicious, but they did say you possibly just have to live with this for the rest of your life. So my objective then would be to find a route where I can live with the ringing. And the thing that affects me most is when I go to sleep at night and I'm
Okay.
having to find strategies to kind of mask it, and then it just affects my sleep. So
Okay.
unfortunately, it's really impacted on my mental health.
Okay. And what kind of musician are you?
I'm an electronic musician, so I play a lot. I'm in a band, so compose. So obviously, it doesn't necessarily affect my work, but it's when I get to the quiet times, I can just hear this ringing, and it just really kind of, some days are better than others, but it does really affect me mentally. So
What I know about musicians or music lovers is that tinnitus, when it starts, it can not only be overwhelming and problematic, but it can threaten the things we love the most, or in some cases, it can threaten your livelihood. So the thing you're most passionate about, the thing you care about the most, the thing that maybe is financially contributing to your life is suddenly at risk. And we sometimes musicians will go down these negative spirals of, does this mean I can never play music again? Does this mean I'm going to lose my hearing? What was your experience with that kind of thought?
I think it's just this thing where for me, sound is such an important aspect of my life. To kind of be walking in nature, and then suddenly I get this, because it's constant, it's just this it's particular frequency, and I can hear it cutting through. And for me, it's become, how can I mask this? How can I deal with this? If I've got to live with this, it's finding those strategies that I need to kind of explore. So it's just looking for those strategies. So
How long have you been dealing with this?
April of this year. So it's quite recent, but it's become a problem in that I feel like it's definitely had an impact on my sleep. I mean, I used to be a really deep sleeper, and now I seem to only sort of average 4 to 5 hours a night. And then I wake up and then I've got to find something to kind of like listen to a podcast or something that will mask it, so then I can go back to sleep. But then I often find that sleep isn't deep. It's very kind of, you know,
All right. So you've had this for about 6 months
yeah,
and you have gone to multiple doctors trying
yeah.
to solve it through that path. And it seems like now you're shifting more towards, okay, it doesn't seem like there's an obvious way to reduce this through medication or surgery. Therefore, what can I do to make it better or cope with it? Is that right?
Yes, I need to find a way of that I can work through it myself. I find when I'm listening to music or I'm making music, it doesn't seem to affect me because obviously the sound is there, the audio is
Mm.
there to kind of mask it. It's just
Okay.
how I deal with those times when I want to enjoy the quiet.
Well, I
But
think you're
yeah,
spot on with looking at what can you do from the sound therapy perspective, what can you do from the cognitive treatment
yeah,
perspective. To me, those are fundamentals, those are foundations that apply to nearly everyone. There's certain cases, and I want to ask a few more questions about your case. Did this start suddenly or did it start gradually?
I just woke up one day and I noticed it because I'm really sensitive to sound anyway. I always have been since a small child. So it was just, whoa. And because it was just in one ear, it was odd.
And then did you get a hearing test? And did that hearing test show more hearing loss on that side or no?
No, it was kind of pretty much similar on both sides.
And then do you have any history of jaw pain, jaw tightness, TMJ issues, or neck posture
I
issues?
did, yeah, I went through a whole series of TMJ. I went to have therapy, but that hasn't made any difference. You
Were you
know,
diagnosed with TMJ problems?
I did go and see a specialist who did say before going down the MRI route that to do this was the option, which I did, but I felt didn't achieve what I wanted. So it was very difficult. I felt quite frustrated.
All right, yeah. So in a case like yours, when it suddenly starts in one ear, we want to rule out a few things. So one of them would be, hey, was there any jaw TMJ issues? There's the jaw muscles in this area, and then the neck. Those systems actually send nerve signals through what's called the trigeminal nerve, the one of the cranial nerves, and that if it's hyperactive or inflamed, that can cause the auditory perception of tinnitus. So we want to rule that out. And going to a dentist to rule that out is typically a good idea if you suddenly have a loud ringing or hissing sound in one ear, and then you get a hearing test and it shows that ear doesn't actually have worse hearing loss. So good job there. We can maybe circle back to that later, but that's something you want to rule out. Once you get the hearing test and you rule out any physical issues, then we are looking at, okay, how can we reduce this from a neurological perspective? So past the ear, past the physical structures, there's the nerve and then the auditory brain. How would you rate your tinnitus impact or problem on a 1 to 10 scale? 1, not a problem at all. 10, an extreme problem. Riz?
Well, I'd probably go 8. You know, it's just something that is there, and some days are better than others. You know, it's how I kind of zone out from it. But because it's there and because of what I do for a living, I think I do kind of focus on it because obviously sound is so integral to my life. So it's just a very, yeah, it's quite difficult to kind of quantify, and
Yeah.
some days are better than others. So
Do you have some days where it's loud and some days where it's very quiet?
yeah, I do have better days than, some days are good, some days are not so good. And the days that aren't so good, I really struggle.
In your specific case, we want to explore the somatosensory or somatic component. We want to make sure there is nothing jaw or neck related or even dental infections, things like that. So if you haven't already, do that. But back to your original question, how can you better manage this? How can you better cope with it? Well, I want to introduce some tools for sleep specifically. So this is a sleep headband. I would highly recommend this.
Okay,
This has some thin speakers alongside the headband. It connects to
okay,
your phone or an iPad, and then you can have soothing sounds mixing in with your tinnitus throughout the night as you fall asleep.
okay,
So we actually have one Treble Health branded that's available on Amazon, that's available in most
okay,
countries, and it's very affordable. So that's an easy win. The next one, in terms of physical tools, this is like a sound machine, a high quality sound machine. It has a little SD card inside of it. So that means we have our own custom sound therapies playing. So if anyone's followed us on online, we actually have, a YouTube video called Shimmer that has almost 4 million views. And we have these sound therapies that were co-designed with sound engineers that I worked with some sound engineers to make them. And they're really good for soothing tinnitus. So
okay.
having this by your bedside table when you're falling asleep, keeping this on at a low level probably helps you fall asleep a little better, but also keeping it on so that in the middle of the night when you wake up to go to the bathroom or you wake up, that the sound is going to be there as like a security blanket, instead of just being in silence like suffering. So those two
Yeah,
pieces on the sound side I would definitely do. And then in terms of the other piece of it, so there is a protocol called cognitive behavioral therapy for insomnia. It's a sleep protocol. On our team, our doctors modify that with our and use it to work with our patients. So there's a specific protocol of what should you be doing in the hours leading up to sleep, what should you be doing when you're trying to fall asleep, what should you do if you wake up in the middle of the night. All of those pieces seem small, but when you put them together, this CBTI protocol, this insomnia protocol, was found to be just as effective, if not more effective than medication in most cases. It takes some work, and
Yeah.
it's not pharmaceutical. It takes some work and
No.
it takes some behavior changes. So that's something that we help patients with. And I find that to work really well, especially when we check in with these people after 2 or 3 weeks. They're like, yeah, I actually am sleeping a lot better. Any
That's
last questions for me today, Riz?
no, that's been very informative. Thank you so much. I really appreciate it.
And where are you calling from?
On the South Coast in England, the UK.
Excellent. Well, I'm so glad to speak with you. Thanks for joining the Ask Treble Health Show.
Thank you so much for having me.
Absolutely. And for everyone else watching, if you'd like to be a guest on the Ask Treble Health Show, check the links below or go to our website and look for treblehealth.com/ask. We'll direct you towards a form where you can get in touch with my team, and then we can talk here on one of these live calls. We're going to be doing these more and more, and it's a really fun way for me to connect with you guys. And hopefully it's really helpful, because if you have a question, I assure you there's thousands of other people who also have that same question. All right, next up we have Doug. Doug, welcome to the Ask Treble Health Show. There he is.
Hi.
Doug. Great to see you, Doug. I know that we've
Thanks.
met before, so would you like to
Yes.
give a little background of who you are in your case, and then we'll jump right into it.
Well, in terms of background, I was a managing partner with Ernst & Young for 36 years. I was with them, retired from them, and am now doing board work and other litigation expert witness consulting. I ended up getting tinnitus from a medication that was given to me. And then I had an issue where I had some equilibrium problems. And after that, I started having some sound sensitivity issues. So my question for you is, how effective have you found exposure therapy to be with people that have sound sensitivity?
Great question. Sound sensitivity, let's define that a bit. So, Doug, what kind of sounds are too loud or too much for you with this sound sensitivity?
Yeah, so it's not as much hyperacusis, which is relative to loud sounds. I do have some sensitivity there, but not to the extent where it would qualify as hyperacusis. But I did develop some sound sensitivity to normal sounds that do not bother other people. And it's not all the time. It can be anything from clanging of dishes or banging tumblers on a counter, maybe certain sounds on the TV. Again, it's not consistent. In other words, it doesn't happen every time those sounds are heard, but it does happen periodically or on a somewhat regular basis.
Oh, great question. So, yeah, sound sensitivity, specifically exposure therapy. So, one example is separate but related. Say, okay, I'm afraid of heights, and I can't stand heights. It's too much. I freak out. My body gets in the fight or flight state. One example of exposure therapy, in my understanding, would be slowly introducing myself with, a guide to 5 feet above the ground, 8 feet above the ground, 10 feet above the ground. It's under my own control. I'm opting in for it. Gradually, I'm showing myself that it's safe, that this is okay. Now, how does that relate to sound sensitivity? It's actually shocking that about a third of my patients with significant tinnitus also have significant sound sensitivity at some point in their journey. And there's hyperacusis, sensitivity to loud sounds. Then there's like misophonia, which is sensitivity to certain sounds. Sometimes there's overlap there. Exposure therapy can be used for both of those techniques. And Doug, I've found that it can be helpful. I would put it under the umbrella of a cognitive behavioral therapy approach to this, and slowly, step by step, turning up the volume of specific sounds. So, for example, dishes clanking, that's an intense one to start with. I might start with one of the more gentle annoyance sounds. For a lot of people, that might be tapping sounds, like fingernails tapping on a table, let's say. So if I'm doing it myself with my own fingers and it's very soft, and I just practice that for, a little bit every day, and I slowly build up week over week with the guidance of an audiologist, then that does work for a majority of patients in my experience. When you're in a calm state of your nervous system, if you can gradually desensitize yourself to these certain sounds, it does take many weeks to really get where we want to. But I have found that it is helpful. How's it going for you? And have you tried it so far?
Well, at one time, I'd be startled by something like even when I would go to print something on the printer and the printer ramps up. But then I've noticed with that, the more I've been doing that, the less sensitivity I have, and I'm not getting startled by it. Some of the other sounds, again, I'm planning to start some exposure therapy to try and address some of those, I guess, to tell my brain or to retrain my brain that it's not dangerous and they're safe sounds.
I'm afraid of spiders to some degree. So for me to desensitize myself to that, it sounds scary. Like, how has it been of trying to do that?
Well, it's just unusual because I never had anything like this before. And like I said, it doesn't happen every time. So, like, I've been in restaurants where there's a lot of noises and it doesn't bother me. It seems like when it bothers me, I'm either being hypervigilant about sound around me or I'm anticipating being bothered by a sound. So, I'm trying to work on those aspects.
Yeah, I really like that because in some sense, for those who can see my hand here, there's like the stimulus itself of, the auditory neurons that fire or respond to a sound. And then there's this filter you have of how sensitive your system is. So if you're at your neutral, let's say here, okay, that's not that loud of it's not that intense of a brain response. So it's manageable. But if you're stressed, if you didn't sleep well, if your diet has been a little messed up, you have inflammation or something, any combination of those things, or you're hyper vigilant about sound for whatever reason, then your filter is it goes down, you're more sensitive. Suddenly the same sound can be perceived as like 5 times more intense. So how do you adjust this filter? I think that leads us to like nervous system regulation and what are we doing to like settle your system so it is more in that homeostasis state, less likely to be hypervigilant. Sometimes patients use guided breathing, other times CBT techniques, other times it's like the sleep protocol stuff or even exercise or health. So what have you found in that regard for your own nervous system?
Well, for mine, what I found is sleep definitely has an impact. The tinnitus and the sound sensitivity are not as bad when I'm sleeping well versus when I'm not. Also trying to do the CBT in terms of when I'm in those situations. Also have tried the breathing to try and calm myself relative to, how I might be feeling at the time. So I've been trying different things, but I've definitely seen a correlation between sleep and the impact on tinnitus and sound sensitivity.
I would recommend continuing with the exposure therapy. Could you quickly summarize how you met me and your work with Treble Health and like some small wins you've seen over time?
Yeah, I'm trying to remember back how I met you through Dr. Jastreboff. He had recommended talking to you and Treble Health. So that's when I reached out to you. You ended up putting me in touch with Dr. Diana, who deals both with tinnitus and sound sensitivity. So I actually was using a different organization relative to my tinnitus and sound therapy or sound sensitivity, I should say. But I just felt like I needed to switch to you and your organization based on our discussions.
Any other questions that I can help answer today, Doug? Great to see you.
No, thank you. I appreciate it.
I love behind you. You got some baseball, you got some football. You a sports guy or what? What's your team?
Yeah, well, in college, it's the University of Florida. I went there. My son went there in the pros, and I've played all sports during my life. So I'm a big sports fan in a number of different sports.
Me too. I was basketball. I'm 6'3", so I had a height advantage. I was junior, senior captain, high school basketball team. We ended up winning the state championship senior year, and I was awarded the MVP of the tournament. Earlier in the season, I broke my wrist in the game, sat out 7 weeks, and then came back and helped our team win in the playoffs. So I love
Wow,
sports.
that's impressive.
It was a fun story. It was a fun
Yeah.
story. All right, Doug, great to see you. Thanks so
All
much.
right, thank you.
All right, next up we have Pamela. What's your question?
I just wonder, what do they do for the treatment, you know?
Yeah, well, tell me a little bit more about your case. Do you hear ringing, hissing? What are your symptoms?
It's like a hissing sound. You know what that sound is like when you play a blank tape and then you turn the volume up real loud and it makes that noise. You know, when you turn the volume up on a blank tape, it's got that kind of sound.
And you hear that in one ear or both ears?
Well, sometimes one, sometimes both.
And how long have you been bothered by it?
Well, it started in April of 2024.
On a 1 to 10 scale, how severe would you rate it?
Let's say 5 or something.
All right, so if you have a 5 out of 10 problem that's been there for over a year, it's a kind of hissing sound, one or both ears. Have you tried anything so far, Pamela?
Try to use sound therapy, listen to sound, and then sometimes when I do listen to sound, then it kind of blocks it and helps, you know, takes it away.
There's a lot of people out there listening also who have had tinnitus for, a year or so. They have it in both ears. It's not a severe problem, but it's significant. It's serious. And my question for you is, have you gotten a hearing test? What did that hearing test find?
Oh yes, they told me that I got a slight hearing loss.
That is a very common case that you described, probably the most common case I help in terms of seeing patients. All right, well, yeah, my advice for you, Pamela, would be get the sound therapy treatment in place. There's various ways to do that, but that's really important. Simultaneously having cognitive components. So let me explain what that means for most people. A sound therapy treatment typically involves either a high quality sound machine or professional medical devices worn on the ears. And you would follow a protocol for a certain amount of months, most commonly. If you've already had this for over a year, I'm looking at around a 6 to 8 month time window of committing to a sound therapy protocol to get the best results. There's ways to do this with professional medical devices that works the best. There's also some ways to do it with sound machines as well. Now, simultaneously, research supports that using CBT or cognitive behavioral therapy techniques for tinnitus works really well. So I see the best results when we combine both of those together, the sound therapy and the CBT. And then for you, you also have, some situations are too loud. That's when I would strategically use earplugs. So Pamela, how long have you been following Treble Health and, our videos?
Well, since last year, I think I found out about it around July, August. Yeah, I was so glad to get to meet you because you're so positive, and I just love listening to you. You make me feel good, you give people hope, and I would really like to meet you guys one day, but I'm so far away. I'm from Michigan, and I'm kind of scared to travel on a plane, but or maybe I could take a train or try to somehow meet you.
I appreciate that. Thank you for the kind words. We have telehealth, telehealth works really well. We've seen over 2,500 patients via telehealth treatment, and the technology works really well. The outcomes are excellent. Now, you mentioned something really important, hope. It's so common that people go to doctors and they're told there's nothing they can do. They go online, it's doom and gloom. But the reality is, in a case like yours that you have, significant tinnitus, in my experience, a majority of cases can bring that down to mild tinnitus. So yeah, that is hopeful. And in my experience, that's based in reality. And the more years I've been doing this, I've been specializing in tinnitus now for 10 years as a professional with grad school and then being a doctor. And the more and more I do this, the more and more hopeful and optimistic I am, because I see it over and over, cases that are told there's nothing they can do actually improve their condition. So Pamela, thanks for coming on the Ask Treble Health Show. Thanks so much.
Thank you so much, and I was so glad to get to meet you, and I'll get in touch with you one day.
Thank you so much. Great to see you. All right, next up we have Mike. Mike, great to see you. Tell me, where do you live and what do you do for work?
I live in Florida, sunny Florida, DeLand, Florida. It's about 20 minutes north of Orlando. When I got my tinnitus, I'm about 60. So it came on in about February, and it just really took me by storm.
Okay. And how can we help today? What's your question?
I don't know if this, at night, it seems like it settles down, my tinnitus. Is that habituation? Or what would that be? It's like almost every night, about 7 to 9, it settles down. And it's weird. I mean, I can always depend on it. Is that thinking, am I habituating?
Let's talk through that, because most people might say when I try to fall asleep, it's worse. So when you're saying in the nighttime, like, talk to me about what time you wake up, what time you go to sleep.
Well,
when it's bad, when it's good. Yeah.
Well, that's another story but I was doing good. Mitra is the one I deal with from you guys. So she's been helpful.
So you're working with
Uh,
Treble Health.
yes, sir.
Okay. Very
And
good. Very good. Thank
I
you.
had knee surgery about 4 weeks ago. I had a total knee replacement, and that kind of,
Common these days, isn't it? I feel like every other person's getting their knee or hip done.
yeah, but it really put a roadblock. All the meds they give you are, so my sleep is going to down in the tank. So I'm taking some sleeping pills now, trying to get back. And so that's where I'm at now.
Okay.
So, but I can always count, even when I'm struggling through the day, about 8, 9 o'clock, it'll start settling down.
My answer to your question is that there are these natural biorhythms in the body. Now, some other patients would say, Dr. Ben, why does my tinnitus get so much louder in the morning? Or after a nap, it gets way worse. Or some days it's bad, some days it's good. There at times are physiological or physical explanations to this, but other times there's not a clear pointing to this reason. But we can understand that there's natural biorhythms to the body, like hormonal cycles, the cortisol stress cycles, sleep cycles. Those are
Yeah.
nervous system. That all makes sense to us. And I think even our mood, right? So understanding that, okay, the body and the brain have these kind of like subconscious cycles going on in the background, we must acknowledge that's true. Once we acknowledge that's true, then we must ask, well, if that's true, could that be the reason why tinnitus is louder or softer in certain times of the day? I would say yes. So one example, for women who are middle-aged, they might be having like menopausal body rhythms, right? For you, it's obviously different. It could be more nervous system, sleep related. It could be potentially stress, cortisol related. But I don't hear that in your history and think, oh, Mike, this means we're missing something. This means we have to change the course of our treatment or do anything different. I would just say that's the way your tinnitus interacts with your body. Does that make sense?
Yeah.
So you're in Florida, got a knee replacement. How's your knee doing?
That's doing great. That's the crazy thing. That's the least of my worries. It's the tinnitus. So I'm just
Okay,
trying to get
you're
over it. That's why I got a meeting with Mitra today at 3. So
perfect. Yeah, so let's get the ears in check. My advice generally would be recognize the moment you're in, that you had a big event, you had a surgery that can create psychological shifts, that can create physical shifts. You mentioned medications as well. So it makes sense to me that tinnitus would get a little worse or more noticeable around that time, after that time, but it's not set in stone. So my advice would be, hey, let's course correct here. Let's bring your tinnitus back into a better place. Where would you rate your problem on a 1 to 10 scale? Like 1, not a problem at all, 10, an extreme problem with your ears.
about a 7.
Okay. I'd like to see that down to a 3 or a 4 out of 10.
Oh, so
And
high.
absolutely. And I think that's realistic. So with that in mind, tell me about what you're using for sound therapy and hearing devices.
Before I met you guys, they're Starkeys. So I got them, and they're pretty decent. And like I said, they've got the masker and the sound generator too. So and
And
I
how
wear
does
them all the time.
and how does that work for you, for someone listening who, has never tried that or doesn't even really know what that is? How has that worked for you?
I couldn't live without them. I put them on it's the first thing I put on when I wake up in the morning, and last thing when I go to sleep. I can hear everything. I can hear the TV a little bit. I got to raise it up naturally, but I still can. The funny thing is, I can hear everybody through the tinnitus. I've never lost that ability.
With family, out of town, restaurants, hearing people's
Well,
voices, has that changed?
oh yeah, yeah. So I am going. I've tried restaurants, tried a grocery store. So what I've learned now is I've got earplugs,
Yep.
and I go, and that's how I go into those places now. Is that the right way to do it?
You're going to a restaurant and you're saying it's pretty noisy and it's loud and it's bothering you, so you feel more comfortable wearing earplugs. Is that right?
Yeah, the earplugs.
Okay. Would you say you have sound sensitivity, meaning that like loud sounds are too loud? Because a restaurant is loud, but it shouldn't be like I need earplugs loud, right?
Yeah, it's loud
Okay.
to me.
Previous to having tinnitus, that wasn't an issue. Is that
Oh
correct?
no,
Okay.
not at all.
Yeah, so that's called sound sensitivity or hyperacusis. And as you're working with us at Treble Health, I would expect the tinnitus to improve over time. I would also expect the hyperacusis to get significantly better. In the short term, during the treatment, definitely using earplugs in a restaurant makes sense. What I want to optimize for is you living your most social, healthy, vibrant life. So yeah, instead of staying at home where it's quiet, I'd like you to go to more restaurants, but be able to protect yourselves in the short term. What I like to see is slowly weaning ourselves off
Okay.
or slowing down or reducing the intensity of the earplug usage so that there's maybe next time or in the next few weeks and months use a less strong, a weaker earplug, and then eventually no earplug. And then
Okay.
eventually the goal would be you don't have sound sensitivity, but you can wear your hearing aids to actually hear people clearly, because a restaurant's often a time where people have the most trouble hearing each other.
Okay.
So based on where you're at, that might take 6 months to slowly get there with
And
hyperacusis.
that's fine. I can still do it. So
I want to tell you a hyperacusis patient story that I have. So this is documented. This is an interview I did with a woman named Loretta from San Diego. It's on our YouTube channel and content. And I worked with her when we first met. Her sound sensitivity was so bad that the air conditioner in her house was like driving her crazy. And that's not that loud. I don't think she had a
I had
loud
that.
air conditioner.
I could hear the air go through the ductwork.
Crazy, right? Crazy. How does this happen to our ears? It's wild. A year later, after following the protocol and working with her, right, I have a follow-up appointment and I'm asking her, okay, how's your ears? How are things? She's like, yeah, ears are pretty good. She casually mentions that she was in the back of her spouse's motorcycle without earplugs and things were fine. And I go, Loretta, hold on. 12 months ago, your air conditioner was bothering you. Now you're on the back of a motorcycle and you're fine. You're absolutely cured from hyperacusis. There is no more hyperacusis for you.
Okay. Wow.
And she was like, yeah, I guess you're right. I didn't really think about it. These changes are so subtle and gradual that she literally forgot that she was cured, or she didn't realize she was cured from hyperacusis.
Wow.
We need to course correct you a bit, but I know you're in good hands working with Dr. Mitra on our team.
Yep. Thank you very much.
All right, Mike, enjoy the sun down there while we're all cold in the winter. I'll actually be spending this winter in Florida at our South Florida location.
Yeah, it's awesome that you guys. I was hoping that Orlando would open soon.
We do have Orlando open for pop-in visits, so we're doing twice a month. Dr. Tricia from South Florida is driving up to Orlando and doing 1 or 2 pop-up clinics a month at this time. So if you wanted to have any in-person adjustments, we can make that happen. Definitely let Dr. Mitra know and we can organize that. All right.
Okay. Thank you. Thank you very much.
So great to see you and thanks so much.
Take care. Yes, sir. Bye-bye.
Guys, thanks for joining. This is the Ask Treble Health Show, episode number 1. Shout out to everyone who joined here live and asked their questions. And for those who are watching the recording, this is a new segment we're doing. If you like it, comment below. This is fun or more of this. And then if you need help with tinnitus, hearing loss, sound sensitivity, reach out to our team of doctors at Treble Health. We have telehealth across the country. We also have in-person clinics that could be in a city near you. So go to our website and look at our locations or reach out to us. We are here to help. Thank you guys so much, and we'll see you later.